This is Dr. Sonia Dhoot, and you are watching this video because you have the advanced stages of dry macular degeneration, something called geographic atrophy. With geographic atrophy, your central retina is starting to develop these areas where your retina is missing, and those little areas are called geographic atrophy. Those lesions usually start a little bit away from your central vision, but with time, those lesions coalesce and grow and involve your central macula. And when that happens, you will start noticing that your central vision becomes more and more affected. Unfortunately, once those lesions have reached your central macula, there's really nothing we can do to make them regress. So all of our treatment options are to slow down how fast they grow and reach the central macula. With macular degeneration, your central vision is always affected more than your distance vision. So you may notice that you're having more and more trouble with close work, namely reading, and that's very common with macular degeneration. When you're looking at something far away, your peripheral vision is able to help more, but when you're reading or doing any close work, your central vision or your macula really does all the work. So changes in your macular degeneration will make your work more difficult. There are injections we can give when we start seeing these geographic atrophy lesions to slow down how fast those lesions grow. The injections are typically given anywhere between 4 to 8 week intervals, and they basically are given as long as we feel as there is vision to preserve. If your central vision is fully gone for whatever reason, we usually will discontinue, but as long as you have useful vision to preserve, we recommend continuing the injections. There are 2 different medications that are both FDA approved to slow down how fast the geographic atrophy lesions grow. One is called Syfovre and one is called Izervay. Both of them have similar efficacy and reduce how fast those lesions grow by about 30% at the 18-month mark, and that grows to about a 40% difference at 2 years. What that translates into in terms of how much time you are saving vision is difficult to assess because the geographic atrophy lesions grow at different rates in different people. But we know on average, those are the reduction rates across the board amongst all patients who have gotten the injections. The injections are relatively safe. Out of 750,000 Syfovre injections, there have been 10 incidences of severe vasculitis concerns, meaning very severe inflammation in the eye after the first or second injection. For this reason, the first 3 injections, I never give both eyes at the same time. And if you only have one useful eye, I will do the first 3 injections in your worst seeing eye to make sure you don't have any infection or inflammation concerns before we start treating your good eye. At this point, Izervay, the other drug, has not had any of those vasculitis concerns. So most patients I'm starting on Izervay for that reason. There is about a 5% chance of your macular degeneration going from dry to wet if you don't do any treatment per year. If we do the Syfovre or Izervay injections, that chance goes up to about 7%. So slightly higher chance of the macular degeneration turning wet. But again, this is done in an effort to try to preserve as much vision as we can for as long as you can. The other side effect of doing injections is about a 1 in 2 to 3,000 chance of an infection every injection. And so that is something that we watch for as well with any injection we give to the eye. If you start having any pain or decreased vision more than 48 hours after the injection, that's something that we need to hear about to make sure you're not having an infection. The first 24 hours after the injection can be pretty uncomfortable, and so we recommend you use lots of artificial tears to keep the eye moisturized, and then usually after the first day, the eye feels like it's back to normal.